You're tired despite sleeping. You gain weight despite eating less. You have intense cravings for sugar and carbohydrates. You feel hungry constantly. Your energy crashes after meals. What's happening inside your body? You might have insulin resistance. Insulin resistance affects millions of women worldwide. Today we're exploring how insulin resistance specifically affects women's health, metabolism, fertility, and long-term well-being. Insulin is a hormone your pancreas produces. Insulin helps cells absorb glucose from your bloodstream and use it for energy. When insulin is working properly, glucose enters cells, blood sugar normalizes, and you feel satisfied with energy. Insulin resistance happens when your cells stop responding properly to insulin. Your pancreas produces insulin, but your cells don't respond. Blood glucose stays elevated. Your pancreas produces more and more insulin trying to compensate. Eventually, elevated insulin becomes your constant state. Your body is flooded with excessive insulin. How does insulin resistance develop? Multiple factors contribute. Sedentary lifestyle, not exercising, increases insulin resistance significantly. Poor diet, too much refined carbohydrates and sugar, increases insulin resistance. Chronic stress elevates cortisol, contributing to insulin resistance. Inadequate sleep impairs insulin sensitivity. Excess body weight, particularly abdominal fat, strongly correlates with insulin resistance. Inflammation throughout the body contributes. Genetic predisposition increases risk. PCOS causes insulin resistance in many women. Insulin resistance affects both men and women, but women are affected uniquely because of hormonal differences. Women's hormones, estrogen, progesterone, and others, interact with insulin. Insulin affects hormone production. This creates complex interactions specific to women. During reproductive years, women experience cyclical hormone changes. Insulin resistance worsens during specific cycle phases. The luteal phase, after ovulation, is more insulin resistant. This explains increased cravings, fatigue, and weight gain during the luteal phase in many women. Hormonal contraceptives affect insulin sensitivity. Some birth control methods worsen insulin resistance, others improve it. Estrogen replacement therapy affects insulin metabolism. Perimenopause and menopause alter insulin sensitivity. Women have higher rates of certain metabolic complications from insulin resistance. Women develop diabetes later than men, but progress faster once it starts. Polycystic ovary syndrome, PCOS, is fundamentally an insulin resistance disorder. Up to 70% of PCOS women have insulin resistance. The insulin resistance PCOS connection is bidirectional. Insulin resistance causes elevated androgens, preventing ovulation. Elevated androgens worsen metabolic dysfunction. Halpshin Yarsan Banya. When insulin is elevated constantly, your body enters storage mode. Your cells aren't absorbing glucose efficiently, so your body stores energy as fat rather than burning it. This explains weight gain despite normal eating.
Hemiferid insulin suppresses glucagon, the hormone that breaks down fat.
With glucagon suppressed, your body can't access stored fat for energy. You're stuck storing fat and unable to burn it. This creates the frustrating cycle. You eat less, exercise more, but weight persists.
Hemiferid insulin increases inflammation throughout your body.
Chronic inflammation contributes to virtually all disease. It contributes to heart disease, diabetes, autoimmune disease, and cancer. Elevated insulin disrupts other hormones. It suppresses thyroid function. It elevates cortisol. It disrupts reproductive hormones. It increases prolactin. These hormonal cascades cause widespread effects. Mitochondria, the energy producers in your cells, become dysfunctional with insulin resistance. Dysfunctional mitochondria cause fatigue. You're exhausted despite adequate sleep because your cells can't produce energy efficiently. Elevated insulin damages blood vessels. It promotes plaque formation in arteries. It increases blood pressure. It thickens artery walls. Weight gain is perhaps the most visible effect of insulin resistance. Women with insulin resistance gain weight despite reasonable eating. The weight tends to accumulate around the abdomen, visceral fat. Abdominal fat is metabolically active and inflammatory, worsening insulin resistance further. Weight loss becomes extraordinarily difficult with insulin resistance. Standard calorie restriction doesn't work because the problem isn't calories, it's hormonal. Eating less just makes you hungrier because your cells can't access stored fat. Your brain senses fuel shortage and demands more food. You're caught in a biological trap. Metabolic rate slows with insulin resistance. You burn fewer calories at rest. Exercise burns fewer calories. Your body clings to weight. Even women who lose weight struggle maintaining it with untreated insulin resistance. The underlying insulin resistance sabotages weight maintenance. Insulin resistance often coexists with metabolic syndrome, a cluster of conditions. Metabolic syndrome includes elevated blood pressure, elevated triglycerides, low HDL cholesterol, elevated glucose, and abdominal obesity. Women with metabolic syndrome have dramatically increased heart disease and stroke risk. This dangerous combination requires treatment. Insulin resistance profoundly impacts women's reproductive health. Elevated insulin stimulates ovarian cells to produce excess androgens, male hormones. This disrupts normal ovulation. Many women develop irregular or absent periods. Women become anovulatory, not ovulating or ovulating regularly. This creates infertility for women wanting to conceive. Women with insulin resistance struggle getting pregnant. Miscarriage rates increase with insulin resistance. Pregnancy complications, including gestational diabetes and preeclampsia, increase. Women with insulin resistance experience more severe PCOS symptoms. During the luteal phase, after ovulation, insulin resistance increases naturally. This explains PMS severity, severe mood swings, fatigue, anxiety, and cravings during the luteal phase are partly insulin resistance worsening. Treating insulin resistance often dramatically improves PMS symptoms. Hanzama. Elevated insulin increases inflammation in reproductive tissues. Endometriosis becomes more severe. Fibroids develop. Polycystic ovaries form. These conditions coexist frequently with insulin resistance. Treating insulin resistance helps these conditions. Hanzama. Insulin resistance creates chaotic blood sugar patterns. Cells can't absorb glucose, so blood glucose stays elevated despite adequate insulin. Simultaneously, your brain isn't receiving glucose signals properly. Your brain senses energy shortage and demands more fuel. You experience intense cravings despite eating adequate calories. Sugar and carbohydrate cravings become overwhelming. You might eat an entire meal and feel hungry immediately after. You feel ravenous constantly despite eating enough. This creates yo-yo eating. Eating, feeling unsatisfied, eating more, feeling guilty, restricting, then binge eating. Energy crashes after meals are classic insulin-resistant symptoms. You eat a carbohydrate-heavy meal. Blood sugar spikes. Your pancreas floods your bloodstream with insulin. Glucose crashes. Your energy crashes. You feel exhausted and want to nap. This afternoon energy crash makes working difficult. You reach for sugar and caffeine, trying to boost energy, perpetuating the cycle. Brain fog and difficulty concentrating happen because your brain isn't receiving glucose efficiently. Memory problems, word-finding difficulties, and inability to focus frustrate many insulin-resistant women. These cognitive symptoms improve when insulin resistance is treated. It promotes atherosclerosis, plaque buildup in arteries. It increases blood pressure. It increases triglycerides. It decreases HDL, good cholesterol. It increases LDL, bad cholesterol, particularly small dense particles. Many women with insulin resistance don't realize they're developing cardiovascular disease. Women often present with heart attacks without warning. What seems like sudden illness has been developing for years silently. Type 2 diabetes develops in insulin-resistant women. Progression typically follows stages. First, insulin resistance develops. Then, your pancreas works harder, producing more insulin, hyperinsulinemia. Eventually, your pancreas becomes exhausted and fails producing adequate insulin. Blood glucose becomes uncontrollably elevated. Type 2 diabetes develops. When 2 diabetes develops, this progression typically takes years. Women progress faster than men once diabetes develops. Women with type 2 diabetes have higher mortality from heart disease than men. Preventing insulin resistance prevents type 2 diabetes. Once diabetes develops, complications increase. Kidney disease, vision loss, neuropathy, and amputation risk increase dramatically. Prevention is far easier than treatment. How is insulin resistance diagnosed? Fasting insulin test measures how much insulin your pancreas produces at rest. Elevated fasting insulin indicates insulin resistance. HOMA-IR calculation uses fasting glucose and insulin to calculate insulin resistance index. Glucose tolerance tests measure blood glucose response to glucose intake. Continuous glucose monitors show real-time glucose patterns, revealing insulin resistance patterns. Unfortunately, insulin testing isn't standard. Many doctors don't test insulin levels. They only test glucose. Many women have normal glucose with elevated insulin. They're insulin resistant but appear normal on standard testing. Requesting insulin testing is important if you suspect insulin resistance. Management strategies include diet modification, low glycemic diet, avoiding refined carbohydrates and sugar, regular exercise, both cardio and strength training, weight loss if overweight, stress management, and sleep optimization. Some women benefit from medications like metformin improving insulin sensitivity. Supplements like inositol improve insulin sensitivity for some women. These lifestyle and medical interventions require consistency but work effectively. Do you experience constant fatigue despite adequate sleep? Do you gain weight despite eating well? Do you have intense sugar cravings? Do you feel hungry constantly? Do you experience afternoon energy crashes? Do you have trouble losing weight? Do you have irregular periods or PCOS? Do you have skin darkening around your neck? Acanthosis nigricans? These symptoms suggest insulin resistance. Recognizing insulin resistance is the first step. You can't treat what you don't know you have. If you experience these symptoms, request insulin testing. Ask your healthcare provider to check your fasting insulin and HOMA-IR. Don't accept normal glucose results as proof you don't have insulin resistance. The good news, insulin resistance is preventable and treatable. Lifestyle changes work powerfully. Losing even 5 to 10% of body weight improves insulin sensitivity significantly. Low glycemic diet helps tremendously. Regular exercise transforms insulin sensitivity. Stress management and sleep help. Medications can support these changes. You're not destined for diabetes or heart disease. Insulin resistance affects millions of women but remains underdiagnosed and undertreated. Your symptoms aren't random. Your fatigue, weight gain, and cravings mean something. They signal insulin resistance. Recognizing this empowers you to seek diagnosis and treatment. You deserve healthcare providers who understand insulin resistance and its impact on women. Cuckoo. Insulin resistance is manageable. You can regain your energy, normalize your weight, and prevent serious diseases. It takes commitment and consistency, but you're worth the effort. Your long-term health depends on addressing insulin resistance now. Understanding your body is the first step to protecting it. Important medical disclaimer. This content is educational and does not replace professional medical advice, diagnosis, or treatment. If you suspect insulin resistance, consult a qualified healthcare provider for proper testing and individualized treatment recommendations.